Hello, I'm Dr. Gregory Davis, gynecologist in Chico, California. Thank you for joining us. Today I'm going to be talking about endometriosis. And what I'm going to go over is I'm going to talk about some of the signs, some of the symptoms, some of the complications that can occur from endometriosis. And then I'm going to talk about briefly on diagnosis, and that will be the first segment. In the second segment, we're going to go in detail talking about the diagnosis and the treatment of endometriosis. So I hope that you'll find that this will be helpful for you. Okay, as we talk about endometriosis, what I'd like to do is just kind of go over a few things that I think are going to be helpful for you. You know, as we look at the anatomy, we have to kind of go back and understand what's actually happening with your anatomy to kind of understand how endometriosis comes about. I mean, how do you get endometriosis? Well, if we look on our anatomy, and as we look on the anatomy, we've got the vagina here, we've got the uterus, we've got the tubes coming on either side, and we've got the ovaries. Well, what happens is that every month, when it's time for you to have a period, your lining inside your uterus has kind of gotten nice and thick. So we got a nice big thick lining inside. And so when it's time for your period, obviously all of that lining needs to kind of come out through the vagina, and that's what we call menstruation. So those cells that are inside the lining of your uterus are called endometrial cells. And so they build up, they get really thick, and then after ovulation, they just stay at that thickness because every month your uterus thinks you're going to get pregnant. At the end of the 2 weeks that the corpus luteum, the guy that's making your progesterone to maintain that lining, as soon as there's no signal there's a pregnancy, then your progesterone's gone, that lining breaks loose. And as that lining breaks loose, as those endometrial cells start to separate from the wall of the uterus, there's a reaction that happens, there's bleeding that occurs, but there's something called prostaglandins. And so I'm going to put that over here. PG stands for prostaglandins. So microscopic, teeny amounts of prostaglandin are being released from each one of those endometrial cells, or from the area where they separate in the wall of the uterus. So the combination of all of that prostaglandin that's being released is just enough to stimulate the uterus, so the uterus cramps, contracts, and then forces that endometrium and blood. So what's coming out is endometrial tissue and blood. So prostaglandins are what causes that to happen. Interesting thing is, prostaglandins are what causes you to go into labor. So when we want to induce somebody into labor, we now give them a little nudge with some prostaglandins, and that may trigger them to go into labor. You know, when people used to rupture membranes to think that that would put you into labor, something about rupturing that membranes releases some prostaglandins, which then causes your uterus to contract, and then you start to have contractions. So every month when you're having a period, you're releasing small amounts of prostaglandins, and that's a normal situation. What happens, and we're not quite sure why, but for some reason, and it may be, there's several possibilities, it may be because there is a genetic component to endometriosis. So if your mom had it, your grandmother had it, your sister has it, you're at an increased risk for that. And if you have a daughter, she's at an increased risk for that. It may be increased as much as 6 or 7 times. But the uterus, instead of contracting normally from the top down to the cervix to force that lining out, it may be contracting from the bottom up. We're not sure, but it can force these endometrial cells out through the tube, and as you know, or maybe don't know, that this is open. So these little cells can start to spill down into your pelvic and abdominal cavity. So these endometrial cells now are going in the wrong direction. They're now winding up inside the abdomen. We think that that may happen with lots of ladies, but the reason, for some reason, ladies that get endometriosis, there may be a genetic component that triggers these cells to somehow get attached inside your abdominal or pelvic cavity, and when they get attached, guess what? They get a blood supply, they're plugged in, they're there to stay. So endometriosis is endometrium that's in the wrong place. It could be in the wall of the uterus, so it could be out in here. It can be down out here in the pelvis in different areas. It can be up in the abdomen. It can be on the appendix. You know, there are rare cases of endometriosis winding up in people's lungs, and every month when they have a period, their lung partially collapses. And there have been cases of it being in the brain. When ladies have a period, they have a seizure. So obviously it's transported through the bloodstream. In some people, we think there may be other components that we're not aware of. But the key thing is that endometrial cells in the wrong place is called endometriosis. So what happens is that when those cells come out and they spill into your pelvic or abdominal cavity, then what transpires is that as they plug in and get their blood supply, every month when it's time for your period, those cells do what? They swell up, they think they're going to go somewhere, they start to bleed. Now think about that for a second. What happens when you and I cut ourselves and we have a little bit of bleeding? Well, there's some sticky protein there, and that sticky protein makes things stick to that. So if you put a tissue on there and hold it, the tissue may stick there because of that protein. So what happens is that when you have endometriosis and those cells inside your pelvic or abdominal cavity, they're now releasing prostaglandins, they're microscopically bleeding, and so they're making sticky proteins. Well, what happens when you got blood in your abdomen and prostaglandins? Well, you get inflammation, and from prostaglandins, let me just kind of explain. From prostaglandins, you can get nausea, vomiting, you can get diarrhea, you can get bloating, you can get cramping, severe cramping, and you can feel like you had the worst flu you've ever had. So all of those symptoms come about from prostaglandins. They're definitely not your friends, that's for sure. So every month when you have endometriosis and you've got all these little satellite cells, they're all releasing prostaglandins, they're all microscopically bleeding. So now instead of having a small amount of prostaglandins that's just normal to make you cramp or contract your uterus so you pass that lining out, what happens is that you've got huge amounts of prostaglandins, and those will cause you to have this tremendous bloating and cramping and nausea as we're talking about. And some ladies may even start to get that a little bit before their period. So ladies that have endometriosis have these cells throughout the body or wherever they may be, and just think about it. That's how you know where your pain is. So if somebody says, oh man, every month when I have my period, I get this tremendous right-sided pain, or they may get the left-sided pain, or you may get some pain and it makes you feel like you have to urinate a lot. Some people have actually had it on their bowel, they get diarrhea. Some people have had it in their appendix, and so what happens is that you get swelling that occurs, and when swelling occurs, all of a sudden the appendix kind of gets closed off, and then you get appendicitis. So I probably see about once every year or two, I see somebody that's had appendicitis or endometriosis on their appendix, for which we have to remove that. So what are the symptoms that ladies have, or you may have, with endometriosis? So the first thing we're going to think about is painful periods. Now, if the very first period that you had when you were a little girl and you started through puberty, if that period was so painful that you stayed home, there's a really good chance that that was endometriosis, because that's abnormal to have pain that severe. Now, if you're a teenager or you were a teenager and you miss school on a regular basis because of painful periods, then in my experience doing lots of laparoscopic surgery for endometriosis, 95% of teenagers that when I do surgery that miss school because of painful periods have endometriosis when I look inside. So if you or your friend or your daughter or somebody you know is missing school because of painful periods, they really need to be seen. That can be definitely taken care of. So painful periods is the first thing I think about. And guess what? The history is if you have painful periods and you don't treat the endometriosis, they get progressively worse. So when somebody tells me, well, yeah, I had a little cramping a few years ago and took some Tylenol, and well, then a year or two ago, then it got a little worse, and I was taking some Motrin, and then I took a lot of Motrin, and now I'm having to take some Vicodin or something because of the pain. Well, that's what we call progressively worsening pain with the periods, and so that to me is very significant. The second thing that can happen is that you can have painful intercourse. Well, how does that happen? These little endometriosis implants that spill out of the tubes, the most common place that they attach is right down in the bottom of the pelvis, right at the top of the vagina. So if somebody's having intercourse and they're pushing up on the top of the vagina, it's going to hit those little implants. Those little implants are going to release prostaglandins. They may even have a little bit of bleeding. And so that's why ladies that have pain with intercourse will sometimes have bloating afterwards, may last for hours, may last till the next day. And if there's a lot of endometriosis and a lot of prostaglandins is being released, you may have sharp pain. There may be a lot of sharp pain. People may even have to stop right in the middle of intercourse. And if somebody says, well, I never had that before, so 5 years ago they never had pain with intercourse, and now they have it, well, that's significant. That tells me that there's more than likely endometriosis. The other thing is pain with bowel movements. Well, it's the same thing. If you've got endometriosis down near the rectum, and as that stool starts to expand down in the sigmoid colon coming down into the rectum, it's putting pressure on those implants. So that starts to hurt. And in fact, frequently I'll ask my patients, or when I see a new patient, and by the way, that's how all these videos came about, because when I see a new patient, I spend about an hour with our appointments, and so we go through everything we're talking about right here on this video. And I've had some patients, I'll ask them, I say, have you had this kind of left lower quadrant pain, way down low, you feel the urge to have a bowel movement, you got this terrible left-sided pain, and then when you go to the bathroom and you evacuate that stool, that left-sided pain goes away, and they go, yeah, how'd you know that? And I go, well, more than likely you have endometriosis on the left side of the pelvis because the sigmoid colon kind of lays against the left side of the pelvis. So as that colon expands and pushes against there, it irritates that endometriosis implants, and then we get all the problems that we just talked about. The other thing that can happen is infertility. Well, how does infertility occur in endometriosis? And I know that when you talk to your friends or you look things up, one of the first things that everybody thinks about is, oh my, I've got endometriosis, I'm going to have infertility. In actuality, only 15% of endometriosis patients have infertility. So put this another way. If we have 100 couples, and all of them have endometriosis and they're all having sex on a regular basis, after a year, 85% of them are going to be pregnant. So 15% may have difficulty getting pregnant. Now the question comes up, what causes the infertility? Well, we used to think it was because, if your endometriosis was minimal, and let me kind of go over that for a second. Endometriosis is categorized as 5 stages. There's minimal, mild, moderate, severe, and extensive. Not based on your pain, but based on what we see inside. There's this complicated scoring system that we use. But the thing to remember is that there's 5 different stages. So you would think that, well, the worse my endometriosis, the greater chance for infertility. Nope, it's actually not true. Infertility can affect even people in minimal, no different than those that have severe, except for the fact if you have severe endometriosis, frequently these people are having intercourse less frequently, so obviously you may have less chances of getting pregnant. So we're not sure what causes the infertility, but one of the things we think that may happen is that when you have intercourse and the sperm comes up through the uterus and out through the tube, fertilization occurs out at the end of the tube, and then that fertilized embryo has to come back down the tube, and that's why your tube kind of milks it along, just like your esophagus when you're swallowing. And then you've got all these little delicate cilia, which are like waves of wheat that just kind of push that embryo back towards the uterus. So as that comes back and it goes plunk and falls into the uterus, it has to attach. And so the embryo has to attach somewhere in the uterus to grow. Well, I kind of think of it as like Velcro. For about 3 days, you make a sticky protein that allows that pregnancy to stick. One of the theories is that you may not make that sticky protein in endometriosis patients that have infertility. Well, that would make sense because these people have trouble getting pregnant even with in vitro fertilization. So even if they give them a head start, fertilize them, and put them up inside the uterus and put all these hormones to get them in the right stage, they may still have trouble if they can't make that sticky protein. So that's one of the possibilities. There may be more factors, and usually there are, as we study it more. But the thing to remember, the good news is that the majority of women that have endometriosis are going to get pregnant. So I think that that's the thing to look at. The other thing is that certainly we talked about appendicitis can occur from ladies that have endometriosis. And so when I'm looking in there for endometriosis, I always take a look at the appendix to make sure that there's nothing going on the appendix. So let's kind of go over it again. What are the symptoms that somebody has? Well, they're going to have pain. May have pain with periods, pain with intercourse, pain with bowel movements. They may have infertility, and they may have appendicitis. There's a couple other things that ladies may have that have endometriosis. It's interesting. If you and I take 100 ladies who have endometriosis and we interview them very carefully, about 80 to 85% can also have a condition called IC. interstitial cystitis. And we've got a DVD on that, or a YouTube video on that, so if you want to check that one out, we kind of go over that in detail. So when I'm seeing a new patient for endometriosis, I always go in and ask them as part of my questions, are you having any urinary urgency? Do you feel like you always have to go? Do you feel like you know where all the bathrooms are at work or at school? Do you go frequently? Do you have pain when your bladder's full? Do you have to wake up frequently at nighttime to go to the bathroom? Have you had multiple bladder infections and then they check your urine and your urine doesn't have any bacteria? Well, if those answers yes to all those questions, well then there's a chance you may have interstitial cystitis. And that's why it's really important, if you're going to see somebody and you have endometriosis, you need to see a gynecologist, because a gynecologist that's going to work up your interstitial cystitis. It's real important because, and we'll get to this in the second segment, but if somebody's going to go in to diagnose you with endometriosis and you have bladder conditions that are going on, they need to evaluate your bladder at the same time. So, ladies that have problems with their bladder, then we want to look at that and we want to say, okay, is there a possibility that they also have interstitial cystitis? And if they do, then we need to kind of work that up. Now, the other thing with endometriosis is that you can have not only these situations here, as we talked about, you may have some unusual conditions. You may have abdominal pain. You may have pain that's not even with your period. You may have pain that's all month long, or it may be mid-cycle. And the interesting thing is, you go, well, why would you have pain at mid-cycle? Well, you know what? What causes your endometriosis to grow? What actually feeds that endometriosis? It's estrogen. Well, when do you make the most estrogen? You make the most estrogen right when you're ovulating. So if you have a bunch of endometriosis implants and you're ovulating each month, making lots of estrogen, then that can feed that endometriosis and cause that to grow. So the important thing is that ladies that are ovulating every month, making lots of estrogen, have a higher chance of causing their endometriosis to grow. Put it another way, if somebody has irregular periods or kind of hitting and missing, which that's a problem in itself, but they may not have as much problems with endometriosis. Now, the other thing is that what else is associated with increased estrogen? Well, fibroids are. And we've got a DVD or a YouTube video on fibroids, and you can check that out. So when I'm doing surgery for somebody that has fibroids and I look in there and we're maybe going to be doing a hysterectomy, about 50% of the time I also see endometriosis. So anytime I see somebody that has painful periods, I'm always going to be doing my own vaginal ultrasound to check that out. I'll also, of course, look at the uterus and see if there's any fibroids. And that brings up, how do you work this up? Well, when I see you as a new patient, it's an hour-long appointment. I get a detailed history. We kind of go through everything, starting back before puberty, going through your teenage years to bringing you up to date now. And it's interesting. I'll ask you, did you notice that, yes, you had painful periods, and then when you went on birth control, it's like, wow, this is great. My pain's gone, I'm feeling good. Well, that's a good thing. And if you notice that you took Motrin or Aleve or Naproxen or Anaprox, those kind of medicines, those non-steroidal anti-inflammatories, and you go, man, my cramping really went away, well, that's a good sign. That means that it's working. So, in fact, that's how we conservatively start with teenagers, is that we will start to treat them with just birth control pills and sometimes just with anti-inflammatories. Now, I've been asked a lot of times, I've had patients that I've seen, and they'll say, I was told I was too old. I was told I was too young. I was told I was too whatever. The key thing to remember, endometriosis can occur from the time you start having periods from 11. I think the youngest I've ever seen with endometriosis was 11. The oldest I've seen has been in their 50s. So, it can occur any time in there. So if somebody's told you that you were too young or too old, well, you know what? That's not necessarily true. The thing to remember is that as soon as you're having symptoms, if you're having increasing pain, you're missing work, you're missing school, it's getting worse, then you need to seek treatment, because there's a lot of things that we can do for that. And even if somebody's a teenager, there's a lot of things that we can do for that. So the thing I want to encourage you is that I would recommend that you see a gynecologist, somebody that specializes in taking care of endometriosis. Now, how do you find that person? Well, the Endometriosis Association has a website that's awesome, and they have a list of doctors that take care of endometriosis patients. All of us are usually belong to the Endometriosis Association. And so that's one way to look up in your geographic area. And if they belong to the Endometriosis Association, there's a good chance that they're taking care of a lot of patients. I think it's important to see a gynecologist that just deals with this because, as you'll see in the next segment on the diagnosis, it's going to involve surgery. And you'll want to go to somebody that's doing lots of surgeries. Technically speaking, to be considered an expert, I think, in endometriosis, you roughly need to be 80 to 100 surgical cases a year, and that's a fair number of cases to really be an expert. Plus, you want to go to somebody that's compassionate, who's caring, who's going to take care of your pain and help you to get better. This is some of the most rewarding things I've done in medicine, is help young teenagers whose life's been miserable to get rid of their pain. So I hope that you found that this information is helpful on symptoms, and in the next segment we'll talk about diagnosis.